Hello and welcome to Connected with Latham, where we discuss ideas, legal developments, and business trends shaping the global economy. This is the 15th episode of the Latham & Watkins Drug Pricing Series, and I'm Chris Schott, a partner in the healthcare and life sciences practice in our Washington, D.C. office. I focus my practice on all things market access, and that includes manufacturer compliance related to the Medicaid Drug Rebate Program, Medicare Parts B and D, and the 340B Drug Pricing Program, as well as, of course, implementation of the Inflation Reduction Act. Joining me is Danny Machado, an associate in our Washington, D.C. office.
Hey, Chris, how's it going?
We also have a guest on our podcast today, and we are very happy that our partner Jason Caron is able to join us. Jason, do you want to introduce yourself?
Yeah, thanks a bunch, Chris and Danny. Great to connect with you all and great to connect with your audience. It's a real pleasure and treat to be on the podcast with you. I've listened to many, most all of them, and look forward to contributing here. My practice is within the healthcare and life sciences ecosystem as well. I sit at the crossroads of largely where the transactional world meets the regulatory world, and spend a lot of time on coding, coverage, and payment issues akin to where Chris sits, but also on fraud and abuse compliance issues, reimbursement matters, compliance program matters, as well as policy matters. And given we're here based in Washington, D.C., the interplay between policy and healthcare and life sciences is certainly a hot topic du jour. So excited to be on the podcast and look forward to this conversation.
Thank you, Jason, and thank you for joining the podcast today. In each episode, we focus on a specific topic that is relevant to market access, drug pricing, or the pharmaceutical and healthcare sectors more broadly. And after discussing the substance, we ask the question, which Olympic sport is it like? And we have the list of Olympic sports here to see which most resembles the topic in terms of strategy, complexity, or frankly, level of conflict. So, Danny, what is our topic for today?
So, as our podcast listeners know, after the major drug pricing conferences, we usually provide a readout. And as some of our listeners may be aware, the JP Morgan Healthcare Conference took place January 13 through 16, 2025 in San Francisco, California, just 1 week before the inauguration of Donald Trump as president. Our firm, Latham, had a big presence there. And so today we want to discuss trends, takeaways, and outlooks from that conference.
Yeah, sounds great. And Latham attends the conference every year. We also host a very popular evening reception. And if you would like to attend the reception next year, just shoot me an email. But I'm jumping ahead. Jason, I know you have attended this conference for many years. Can you tell us a little bit about the conference and its significance?
Yeah, happy to, Chris. So the conference has been going on remarkably for well over 40 years. I myself have been going for over 15 years. And it's, to me, the largest, broadest healthcare and life sciences conference that exists right now domestically in the US. You've got folks from traditional healthcare interests, be it health plans, healthcare providers, health systems, and then you've got folks that are from traditional life sciences interests, so big pharma, big med tech, all of the innovators in those spaces, so digital health companies, innovators from the life sciences community that have pre-commercial products, for example, and then all of the backbone that provides support to healthcare and life sciences, revenue cycle companies, big data companies, CROs, whatever the case may be, and then the large network of folks that support the healthcare and life sciences communities, be it accountants, business process professionals, compliance professionals, lawyers, and then the investor community, of course, is there. And there certainly is a broad range of folks that are routine pillars. Of course, the main event, JP Morgan's main event, is certainly the keystone event. But interestingly, there are a number of what you might call sideshows that are sought out destinations as well. I think, Chris, you referenced our event. This year alone, we had over 1,000 people come to our reception and roughly around 100 Latham colleagues from across the globe interfacing with our clients of all of those different areas of expertise, focus, industry insight, whatever the case may be.
And Jason, you mentioned that the JP Morgan Healthcare Conference has been going on for many years now. What would you say has been the evolution of the conference over the past few years? How has its significance either increased or changed from your perspective?
Yeah, I would say it's interesting with the market being somewhat in check for the last couple of years, coupled with the pandemic. You've definitely seen what was an event that had gone on for years and years and grown, up and to the right, more people, broader range of content and the like. Certainly took a couple of steps back during the pandemic, and I think as the market reset, we did see folks' level of engagement around this set of conferences or this conference and set of events, I should say, really scale back at some level. But this year, Chris, I think you probably have a similar sentiment. The energy was back. I love to say San Francisco is bouncing back as a city. It's a city that we have colleagues and friends that live there, and I think the city is bouncing back. We're seeing these autonomous driverless cars everywhere. It's really cool. I'm a fan personally. And then this year too, like the sun made a cameo in San Francisco in January, which was really kind of cool. Being in Union Square, being outside, and not having to find a little nook of a coffee shop to escape the soggy rain and actually be out standing in Union Square, networking and collaborating with friends, colleagues, clients, and the like. So it's a conference that I think I have a lot of optimism about for next year and into the future. I think it's a great place to kick off the year, whatever way you're thinking about that, reestablishing connections that I've had for over a decade, meeting new folks that I've recently started to work with because we all happen to be descending upon San Francisco during that time, reconnecting with colleagues that are flying in from Europe, wherever the case may be. It's just a great place to start off the year. And so in that regard, big fan.
Yeah, definitely agree. This year was kind of special, but we have to sort of adjust our data and calculate out the sun and the good weather because that's not a guarantee. But I would say even removing that as a factor, definitely agree that there was a vibe of interest, of enthusiasm this time. So there was definitely a feeling of it was energized, an energized meeting. People highly motivated and in good spirits. So I definitely agree. It's a good way to start the year. That's for sure. So you mentioned a little bit about the type of organizations that go and the type of companies you can expect to interact with over there. So who are the people that they send? Is it the C-suite? Is it, you mentioned deal makers. So more specifically, kind of who are the people that you can expect to meet there and interact with?
My experience has been it's a diverse audience. I mean, typically, just by virtue of the cost to attend. Hotels, for example, are on a JP Morgan week versus a sort of traditional week in the Bay Area are premium priced, I'll call it. And so when you think about the relative cost and everything, most people are sending the C-suite. So it's the senior executives, but there are also a range of folks, to no surprise, in a business development capacity that are there. So folks that might do M&A for a particular company, for example, but also folks that are there to speak to subject matter expertise. And so you do have unique topical areas that are being discussed in a lot of these side conferences in particular, where you may have specialists that are focused on market access, Chris. And so we do see some a decent number of market access professionals there that are in leadership positions in that regard, but are really there to interface with a number of their advisors. There are regulators that also come. And of course, when you're thinking about the diversity of the audience, payers are in the room as well. And so as a result, there are opportunities to reconnect or connect with that diverse audience and understand how they're thinking about things, how they're speaking about things, how they're talking about new products, whatever the case may be. It's definitely more C-suite orientation, but I would not say that's exclusive.
And Jason, we heard you mention earlier that the conference sort of sets the tone for the year with regards to healthcare matters, whether they be deals that people are envisioning or matters that are on their mind. What key themes, I wonder, did you see emerging from this particular year's JPM conference?
Yeah, I think there's a host of themes that I would identify as I was reflecting and thinking about our conversation today. And I'll walk through them here, which would be One, and I think, the leading one is there's just a sense of optimism right now from the deal making world as it relates to one, moving beyond the antitrust regulatory guardrails that existed under the prior administration, in this one particular consideration that was discussed, and just the notion that between what would be perceived as a more commercial environment, that coupled with just, I think, some belief that we're likely to see market conditions generally improve for deal making. Put those together, and I think a lot of folks were coming at it with, I don't want to say untethered optimism. I think it's cautious optimism, but certainly a much greater degree of optimism. And it's interesting the way I sort of gauge this is last year when the market was more in check, when I ping folks in my personal network to say, "Hey, are you going to JP Morgan?" For which every year I ping dozens of people, about 50% of my network would say, "Hey, I'm just not going this year." And that was last year. This year, I would say, and, this is not empirical, but probably 80% of my network said, "I'm going, and hey, let's meet and let's talk about this subsector that we're thinking about doing a deal in. And we'll love your insight so we can be more informed as we're having these conversations." And so a lot more engagement at that level as a litmus. So I think optimism around the ability to transact is sort of probably point one I'd make. The other one, and sitting here today with the confirmation of new secretary at HHS, there was a ton of folks talking in the halls about, what does the healthcare policy, what does the agenda look like as we think about the next 3, 6, 12 months and years ahead, and how might that shape what's going to be on the radar, what's potentially going to be off the radar, who's going to be in the seats and driving that agenda, and then questions because of where we sit, how do we have a thoughtful strategy? Where should we engage? How do we engage? Who are the advisors that we should be engaging to make sure we have a seat at the table on the issues that are important to us? And so a lot of folks starting to think about developing their government relations strategies and refining their government relations strategies in this new paradigm, and then thinking about and starting to spitball on the issues that are important to them. That's probably issue two, at least on my side. No surprise, it's healthcare and life sciences. Innovation is always part of our conversations. It's always part of the conversation at JPM, be it new innovative service delivery models, new technologies, new therapeutic classes, whatever the case may be. And I think the innovation probably was disproportionately focused on AI and data. Not to say it didn't cover other topics. There are certainly a range of other topics, but to no surprise, AI and data. But here in this environment, it's less, I would say, pie in the sky on potential use cases for AI and data. It was much more of a sort of pragmatic level of where are we actually seeing AI tools successfully deployed, where costs can be averted or value can be driven, and what parts of the healthcare ecosystem did we see deals in 2024 where people were running a sort of AI tool thesis, and how could that be leveraged as we think about the next generation of pragmatic deals to be done, which could be affiliations, could be acquisitions. It's a range of different options, but how do we think about that? So that's probably topic number three. And then probably topic number four, and I think this was just, part of the ecosystem, but I think it came up in a number of conversations, is on the heels of the wave of digital health emerging in the pandemic, technologies coming forward, a lot of capital being available, a number of companies built go to market opportunities and arrangements and really started to get out of the gate in the digital health ecosystem. However, a lot of those companies have tried to navigate their performance and may not necessarily be profitable just yet. And so the discussion was, how do we get, some of the digital health companies that are doing some great things at a consumer level and really doing some great experiments and innovation, but how do we get those companies to a place either that they need to either restructure or enter into an arrangement and tie themselves up so they can drive some synergies to become more profitable and poise themselves for the next iteration of capital infusion. And so definitely a lot of discussion around some of those companies that are in the space. And of course, I won't name them here, but that was a broad ranging theme that was in play here. That's the list that I throw out there of things that were on my radar. And it's a great list. I think it was a lot of fun to have these conversations around these topical areas in an area where I felt that the Latham team was poised to engage, partners that were there. It was easy to grab them and say, hey, here's the connectivity. This person's done a ton of work in AI and data, and you should meet them and talk to them about the types of things they're working on at a generic level and how you might be able to apply that to your strategy.
Yeah, Jason, very interesting. Thanks for that deep dive into the background there. And maybe I can just chime in with some of the trends that I've been hearing about that Danny and I are seeing in the pharma space. Obviously, the conference took place before the inauguration, so since then we've had, a month now to see how things shape up. And as you know, the confirmation hearings are proceeding. So obviously, the topics that we saw as hot topics in pharma were Inflation Reduction Act. Everyone's wondering how the implementation will proceed on that one. And then, of course, there are questions about some of these initiatives that were promoted by the Biden White House, such as the importation pathway of drugs from Canada. There's been some chit chat about that in the trade press. Will import duties do anything to that process? And so it remains to be seen how the states can proceed with that and what the next steps there might be. And then, of course, the question of margin rights, where Biden was a proponent of using price as a factor for the government to decide whether to exercise margin rights. And we've heard kind of mixed messages over the last few weeks on whether that is still of interest to the Trump administration or what that might look like. So definitely a lot of things to track, things to keep paying attention to as the new administration sets itself up and begins to actually take action on these various policies that they're talking about. So I think that really takes us to the question we had asked at the outset of this podcast, which Olympic sport is all of this like? So Jason, why don't you go first? Tell us what you think.
Yeah, this is easy, Chris. For me, it's marathon swimming. So why? We talked about San Francisco. You've got the Bay, you got Alcatraz. It's generally pretty soggy. So you're wet. There's no doubt about it. But also, it sort of takes mental strength. You're having conversations at a frenetic pace, meeting new people, reconnecting with other people, going deep, saying hi. So you're sort of working all day long. So I'd say there's an endurance aspect. It's when I go out there, it feels like it's an 18-hour day, coast to coast, starting with a morning jog with one client or colleague or friend, and finishing up with a nightcap in the wee hours and rinse and repeating. And I think you have this endurance piece as it relates to typically walking through San Francisco. So you're climbing a few hills and you're getting into it. So I think the marathon, a wet marathon, is sort of the way I characterize it. So marathon swimming would be my vote.
Great. Danny, what do you think? What did you pick for today?
Well, I think that's a great one from Jason for sure. I picked the steeplechase, and if you're not sure what that is, I can tell you for a minute. It's a track sport, but it's a little unique. It's a grueling, I would say, 3,000-meter race where athletes need to conquer a bunch of barriers and water jumps. It's a very unpredictable sport. Athletes can slip on barriers, they can land off balance, they can somersault forward. They could even land head first in the water pit if they're not careful. And as the race goes on, conditions get increasingly wet. I think that's a theme we're seeing here as water splashes through the race, gets into the athlete's shoes, just crazy stuff. And it made me think about we were discussing here with a new presidential administration. As lawyers, we'd like to know what's coming down the pike. But at least in the short term, there's a lot of unpredictability and unknown. So we're going to have to keep advising our clients to maintain eyes wide open for every uncertain condition down this racetrack. So that was me. Chris, what did you select for your Olympic sport?
Yeah, I'm going to stretch a little bit today and pick a sport that was Olympic in the past and is not Olympic right now. And I'm going to pick polo. It's been called the sport of kings, and I think in today's world we can call it the sport of oligarchs. And it just came to mind as I was contemplating what to pick. Somehow that made sense for me, so I'm going to color outside the line and go with polo for today.
Yeah, I'm going to push you, Chris. Is it polo or water polo? Because I
Now
mean,
it's actual polo.
Danny and I were definitely.
In the aquatic space.
You have to have special, thoroughbred ponies for polo, so it's all on land. The sport of kings. Excellent. I think that wraps up our podcast for today. Danny, where are we going for the after party? What have you picked out for us?
So one idea I had, and you guys tell me if this sounds good or not, but it's a relatively new spot in Georgetown called Osteria Mosa. It's Italian, and the pasta, I went the other day, it's so good. And then I was thinking maybe after we could walk on over to the Blues Alley Jazz for a cocktail and some live music. What do you all think?
I'm in.
Definitely on board with that. And I like how you've mapped out a whole evening for us. We really appreciate that. Definitely looking forward to that. Thanks to Jason for joining us today and sharing his insights on the JPM conference. And thanks to Danny for being a moderator. And thank you to our listeners for checking out the Latham & Watkins Drug Pricing Series, which is part of our Connected with Latham podcast. You can subscribe and listen to new and archived episodes of Latham's podcasts on lw.com, Apple Podcasts, Spotify, or anywhere else you listen to podcasts. If you have questions or would like additional information, please email us using the links located in the show description. We hope you'll join us again next time.
This podcast is provided as a service of Latham & Watkins LLP. Listening to this podcast does not create an attorney-client relationship between you and Latham & Watkins LLP, and you should not send confidential information to Latham & Watkins LLP. While we make every effort to assure that the content of this podcast is accurate, comprehensive, and current, we do not warrant or guarantee any of those things. And you may not rely on this podcast as a substitute for legal research and/or consulting a qualified attorney. Listening to this podcast is not a substitute for engaging a lawyer to advise you on your individual needs. Should you require legal advice on the issues covered in this podcast, please consult a qualified attorney. Under New York's Code of Professional Responsibility, portions of this communication contain attorney advertising. Prior results do not guarantee a similar outcome. Results depend upon a variety of factors unique to each representation. Please direct all inquiries regarding the conduct of Latham & Watkins attorneys under the New York's disciplinary rules to Latham & Watkins LLP, 1271 Avenue of the Americas, New York, New York, 10020. Phone number 1-212-906-1200.